So, in the last year, this ultra-thin bronchoscope was developed. Is a 3 millimeter external diameter with a large 1.7 millimeter working channel. And this working channel allows you to use such kind of needle that was specifically developed for the ultra-thin bronchoscope, that is a very flexible needle with a 21 gauge diameter and a 20 millimeter length. What is the rationale to use ultra-thin bronchoscope and needle? Look at this lesion. This lesion is outside the bronchial tree. If we use a standard bronchoscope, we can have the needle that is going in this way, or in this way, or in this way, but we cannot reach the needle, the lesion. If we use an ultra-thin bronchoscope, we can approach the lesion. We can bend the tip of the ultra-thin bronchoscope, and using the needle, we can penetrate into the lesion. Well, there is just one study that compares the ultra-thin bronchoscope, 3 millimeter, versus thin bronchoscope, 4 millimeter, for pulmonary nodule less than 3 centimeter. This study used virtual bronchoscopy, ultrasound mini probe, and fluoroscopy as guidance system. A large number of patients were randomized, 356 patients, ultra-thin versus thin bronchoscope. And you can see that the diagnostic yield using ultra-thin bronchoscope is 70%. That is statistically higher in comparison to the thin bronchoscope that has 58% of sensitivity. So the conclusion of this study is that the use of a 3 millimeter ultra-thin bronchoscope resulted in a higher diagnostic yield and a shorter procedure duration without affecting safety, comparing with the thin bronchoscope, 4 millimeter. I show you this real case. This is a lesion. There is the bronchus that is not leading into the lesion, but is adjacent to the lesion. Well, if we use a standard scope and inserting the needle, you can see that we cannot sample this lesion. But if we use an ultra-thin bronchoscope, and we can bend the tip of the ultra-thin bronchoscope very close to the lesion, and inserting the needle, we can reach. And you can see here the real procedure for this case with a movie that show you the ultra-thin bronchoscope that bend just proximally to the lesion, and the needle that penetrate and allow us to perform diagnosis. So you can imagine the difference between such instrument. And I would like to show you some real clinical cases. This is case number 1 and case number 2. You can see here 2 nodules located in the left upper lobe. Well, look at the ultra-thin bronchoscope that is able to reach such peripheral lesion. The bronchus is outside here, and bending the tip of the scope and using the needle, you can penetrate into this lesion that was an adenocarcinoma. And again, this sample has been reached with the ultra-thin bronchoscope, and again is an adenocarcinoma. Now look at this very peripheral nodule, very subpleural nodule. It's possible to reach this nodule using a bronchoscope? Yes, it's possible using an ultra-thin bronchoscope that reach the lesion and that was an hamartoma. Of course, this lesion could also been sampled by percutaneous needle very easily, but you know that the risk of pneumothorax with percutaneous approach is higher in comparison to the transbronchial approach. And in this way, we can reach also very, very peripheral and subpleural lesion. Look at this small nodule in the middle lobe. Are two different cases, but the lesion is very similar. It's possible to reach the lesion bronchoscopically. If you use an ultra-thin bronchoscope, you can see that you can reach the lesion and you can insert the needle inside the lesion and you can obtain material, diagnostic material. And also in this lesion, look at, it was adenocarcinoma. Look at the ultra-thin bronchoscope, the needle inside the lesion, and the diagnosis was different because this was a carcinoid. So you can understand how it is important to perform diagnosis of different peripheral lesions. Carcinoid, adenocarcinoma.
How can you be sure that you are in the lesion? Why not in front or at the back?
We use also mini probe, ultrasound mini probe, ultrasound to confirm. Ultrasound mini probe is not a guidance system, it's a confirmation system. We guide with a fluoroscopy, and to be sure we use a ultra-thin mini probe that can be inserted in the ultra-thin bronchoscope to verify if the lesion is centered or not. Look at this. It's 1 centimeter nodule in the middle lobe. Again, we can reach the nodule with the ultra-thin bronchoscope. We can get a sample, and again, also this nodule was a carcinoid. These are two cases of very para-mediastinal lesion. Is a right upper lobe, very close to the mediastinum. Here is the bronchus. If you use a normal scope, you are not able to bend the scope and to reach the lesion. Look at. This is the first case. And this is the second case. Can you see how the scope is bended close to the lesion? And this is possible just using an ultra-thin bronchoscope. And this was, again, an adenocarcinoma. Diagnosed bronchoscopically, very easily to perform. Look at this small nodule. Very difficult to reach, close to the descending aorta. Look at flex ultra-thin scope and the bending of the ultra-thin scope close to the lesion allow us to obtain diagnosis. And again, it was an adenocarcinoma. So what are the conclusions of this talk? The conclusions are that the use of an ultra-thin bronchoscope with transbronchial needle aspiration could be a way to improve the diagnostic sensitivity of the transbronchial approach to peripheral pulmonary nodules. And the most important thing is that ultra-thin bronchoscope can be used with all the guidance system. If you use electromagnetic navigation, you can use ultra-thin bronchoscope. If you can use ultrasound mini probe, you can use ultra-thin bronchoscope. If you use fluoroscopy or virtual bronchoscopy, you can use ultra-thin bronchoscope. If you use combined CT, you can use ultra-thin bronchoscope. You cannot use ultra-thin bronchoscope just with a robotic bronchoscopy, because robotic bronchoscopy has dedicated probe and dedicated scope. But I think that not many people, at least in Europe, use robotic bronchoscopy. So This is the conclusion. Thank you very much for your attention. And now, if you have any question, please don't hesitate. Thank you.